I don't know if you've been paying attention to the news, but since all of this COVID nonsense has been happening, the hospitals have essentially closed off all their ancillary business operations in order to respond to, frankly, what is, I believe, is one of the greatest frauds being perpetrated on us in the history of this country. Munson Hospital announced layoffs. Says we're losing $7 million a month. Beaumont Hospital closed an entire facility, laying off thousands of people. What we really have here, unfortunately, and then they can only respond, I suppose, in ways that they can respond, but this could have been seen coming. We have in Michigan what's called the CON, the Certificate of Need. Basically, it holds off any new hospitals, any new facilities with beds or the ability to have people stay for treatment, unless it's been determined there is a need for that service. Now you say, well, hospitals are closing, the beds are empty. Why would we need more? This is why. In the last 3 decades, what you've seen is you've seen thousands of hospitals throughout the state. Thousands of small hospitals and clinics throughout the state be consolidated into a group of maybe 5, 6, half a dozen or maybe a couple more. And unfortunately what happens is, the price goes up because these are not small operations. They are full-blown. Certainly they want to do the best job and they say that there's value in them. But I have to think that in this type of crisis, if instead of one system that serves an entire Northwest region, if we had the 20 or 30 that used to exist, 20 or 30 that used to exist, some of those hospitals could have stayed open. They could still be performing regular health checks, outpatient surgeries. Some of those hospitals could have been still operating as normal, while maybe some of them could have been handling the COVID crisis, and maybe even at a little higher premium. The point is, in the end of all this, we need to take a serious look at how our health care system in the state of Michigan is organized. Having all our eggs into the 1 or 2 or half a dozen baskets that we have them in the state of Michigan, it opens up those workers in that particular field to non-competing situations. It doesn't give them any options if they want to move from one hospital to another to better their lives. And it sure as hell doesn't help the communities when a place like Beaumont completely closes down and ties up our emergency services while they move patients from their hospital to another in order to save money. Government is the enemy here because it's government that causes the Certificate of Need program to exist. All right? I can tell you this. Legislators who might think they're going to fight this, they're going to have a hell of a fight on their hands because those hospital systems will fight tooth and nail for all the investment that they have into it. But it needs to be done. We need to free up, open the markets, lower health care costs, and prevent the kind of crap that's happening right now that ought to get everybody angry. And the Certificate of Need. And do it soon. Sooner than later, before we have another situation like this.